I'm Dr. Mae Syki-Young. I'm an OB-GYN and I'm affiliated with Makati Medical Center and St. Luke's Medical Center, BGC. First, before you consider using the menstrual cup, ask yourself if you are comfortable to touch yourself because you're the one who's going to insert it inside and you're also the one who's going to remove it. Before you do the switch, talk to your doctor. Tell the doctor why you want to make the switch. Because if you are the type of the person na careless, you don't like to clean the cups and all that, then I don't think it is right for you. So menstrual cup is actually very convenient for some women because they don't need to bow a napkin. No, you have to, just the menstrual cup, it's inside and then they just wash it. But this is the thing, washing it and cleaning it sometimes is also messy. You have to bring something to clean it properly and your hands has to be clean. So now, how do you know the proper size of menstrual cups? Okay, so this is actually more of trial and error. But as a general rule, if again you're young, never gave birth, then siguro naman nasa small ka lang, no? But the different menstrual cups have different designs. Yung iba medyo mas elongated, no? Yung iba medyo mas matambok, and then their stem where you will pull it out is also different. How do you know the length of your cervix? The length of your cervix is this kwelyo ng matres, okay? It's very difficult for you to measure the length of the cervix. So I think more important than the length of the cervix is the length of your vagina. Vagina is here, this is the canal of the vagina, and outside is your vulva, where you see the outside reproductive. You should not put your menstrual cup up to the end. Dito sa cervix, don't. So usually, it's around here lang. And when you insert the cup, that's why I say it's more or less trial and error. Kasi if you insert it, hindi pwedeng dapat yung stem nakakapa mo sa labas. It's too low. So you have to insert it medyo tama lang. So if you feel that you can feel the stem outside your vulva, then it's too low. So, but if you put it too high naman, you might totally occlude the cervix. Putting it inside is also a challenge. Remember, the menstrual cup is made of silicone or latex. Sometimes madulas yan, no? But if you don't also lubricate it sometimes, it's also very difficult to insert. So you can put, let's say, lubricant, no, to insert it. So usually you press the base and insert it inside. Then pag nasa loob na, you have to release the base. And then if you turn the cup a little, it will kind of seal the vaginal canal. So remember this vaginal canal, this is cross-section. Syempre yung canal mo, sarado yan, parang tube. So the menstrual cup will just seal off the side. That's why usually if you do it correctly, hindi ka matatabusan. Hindi siya maglilik. For some patients, they need a longer vaginal cup because the vaginal canal is longer. So maybe you can see your doctor and ask your doctor, Dok, mahaba ba yung vaginal canal ko? Do I need a longer one or okay na sa akin yung shorter one? Another thing to consider is malakas ka ba magregla? If, example, you're on the pill, your period is really lesser. So you might need a cup that is not very big, small lang, and enough lang for your vaginal canal. The challenge lang there is to really clean it properly because you are introducing something that is foreign pa rin in your vagina. And do not forget to change it. There are a lot of menstrual cups. Now, sometimes you might have allergic reaction to menstrual cup, so you have to take note of that. Sometimes you have irritation, makate. So if you have a lot of, very often you will have vaginal irritation, then maybe that is not for you. It will take some time for you to get used to inserting the menstrual cup and also removing the menstrual cup. One more thing, if you don't have any sexual contact yan, then it will be more difficult to insert. Remember, with an intact hymen, no? So mas maliit yan, papasok, even if you use a small one, no? So if you don't know how to use it properly, first time mo, pwedeng may masugat while you're inserting the menstrual cup. But the vagina naman kasi is very elastic. I think when you get used to the menstrual cup, parang wala ka ng suot. Actually, that's also one thing that is nakakatakot. You might forget to change the menstrual cup kasi you don't feel anything. Pag hindi mo yan pinilitan ng matagal, the blood is just there. It is just there na nakaipon, no? Somehow, we don't want that also. Kasi the blood that is there for a long time can also is a good culture medium for infection, ha? So, kung feeling mo medyo malakas ang regla mo, kahit na naka-menstrual cup ka, there's no harm in removing it and clean it more often. No, wag naman 12 hours katulad ng sinasabi ng ibang article, no? For me, kahit na-check on it every 3 to 4 hours, especially on your heavy days. Research about it. Second tip, talk to your doctor. Because let's say there's something wrong with the anatomy of your vulva and vagina, then we will tell you that it's not better not to use it. But if you're okay with it, at least we can see the length of your vagina and the size, and we will give you medyo at least alam mo na what size to get. The right size would fit well, which means that there will be no leakage dapat. And then also, third, ask yourself why you're doing it. Are you doing it because you want to be convenient for you? And then, of course, syempre, all in all, it will give you less expenses. Kasi it's reusable eh. You can use it for a year, apparently, and then next year ka na ulit bibili ng menstrual cup. But I've heard of some patients na ang tagal nila ginagamit yung menstrual cup, like more than a year. So it's really budget-friendly. Do not leave it for a long time because we don't want you to get infected. So if you're going to do the menstrual cup and then you get more and more infection, more often na may infection ka, then I don't think it's worth it. No?